Hello, good morning. My name is Catherine Lavarias. I'm a family nurse practitioner from Purdue University Global, and I would like to thank you for making time to meet with me to discuss about the patient I saw earlier. Um, so he is with the initial AA. I saw him earlier this morning. He came here for his annual physical exam. He is a 37-year-old white male, present to the office for his annual checkup. He is up to date with his immunization. He denies any major illnesses or past surgery. He has not done any cancer screening tests. For medication, he don't have any medication, both prescribed or over the counter. He's not taking anything. Allergies, he don't have any known allergy or any known drug allergy. As I mentioned earlier, he said that he don't have any past medical history or past surgical or hospitalization. Family history, his mother is alive and well, so was his father, alive and well as well. Social history, he denies smoking, he denies drinking and using illegal drugs. Living arrangement, he lives with his wife and they have one kid. He graduated, he finished his college and he's working as a software engineer. He denies any physical or mental abuse. Sexual activity, his last activity was 3 days ago. Preventative or health immunization, he is up to date to his immunization, but he has not done any cancer screening or he is not doing his monthly testicular self-examination. He denies fever, chills, denies any loss of appetite or weight gain or weight loss. Cardiovascular, he denies any chest pain. He don't have any palpitation or any history of hypertension or any cardiac disease. Skin wise, he denies any problems or changes in his skin colors. Respiratory wise, he don't have any shortness of breath. He denies any shortness of breath, cough, or respiratory disease. For the eyes, he denies any changes in his vision. There's no pain or blurry vision. He does not use any contact lenses or glasses. Ear pain, he denies any ear pain. He denies any hearing loss or tinnitus or vertigo. For nose, throat, and neck, nose and sinuses, there's no problems with the sinuses. He denies any change of smell. Mouth and throat, he denies any sore throat. Dental problems, he denies any hoarseness of voice or vocal changes, or mass or swelling or difficulty swallowing. For the neck, he denies any neck pain. He denies any mass, swelling, or swelling of the thyroid glands or lumps. Gastrointestinal, he denies any abdominal pain, nausea, vomiting, diarrhea. He does not complain any of that. He denies any changes in his bowel movement. Genitourinary for male, he denies any changes in urination. He denies any hematuria or denies any previous UTI. And like I said earlier, he denies any monthly testicular self-examination. Musculoskeletal, he denies any muscle pain. He denies bone fracture, no joint pain or weaknesses or tenderness. Endocrine, he denies any increased thirst or hunger, no history of diabetes. He denies any heat or cold intolerances. Peripheral vascular, he denies any leg cramps or swelling or varicose veins. For the breast, he denies any breast pain or changes in contour, no lumps or mass. He denies any of that. Hematologic, he denies any blood transfusion or easily bruising. He denies all of that. Neurological, there's no dizziness, changes in sensation, speech or numbness or tingling, no loss of consciousness. Psychiatric, denies feeling depressed. He denies any feeling of anxiety. He denies any suicidal ideation. For the objective, his latest vital signs are blood pressure of 119 over 64, heart rate of 76, temperature of 36.7, his respiration is 20, his latest weight is 168 pounds, and his height is 5'7". From with this height and weight, he is within normal BMI. So he general appearance, he is alert and well groomed, well nourished, and not appearing in distress. He has a normal mood and affect, and can ambulate without difficulty. Skin wise, he has appropriate skin color for his ethnicity. No visible lumps, bumps, or masks that I can tell from my assessment. For the head are normocephalic, no visible trauma that I can tell. For his eyes are equally reactive to light and accommodation. It's intact. He denies any, as previous, he denies wearing glasses or contact lenses. On my objective assessment, his eyes are intact. For the ears, both external ears are intact as well, no lesion or mass. Auditory canal are normal. Tympanic membranes are intact, or they're not inflamed with light reflex. For the nose, bilateral nares are negative for obstruction, no mucus or discharge that I notice. Septum are in midline, no sinus tenderness. Mouth mucosa are pink, moist, and intact. Tonsils are not inflamed. Neck, no tender or mass. Trachea are in midline, no carotid, bruit, or murmur on auscultation. No jugular vein distension. The neck is flat to touch. Cardiovascular, S1 and S2 are noted. No S3 or murmur appreciated. Peripheral vascular denies any swelling in the face, hands, or feet. No swelling on the legs, no leg cramps, no varicose veins that I notice. You don't have any edema, and there's no tenderness on palpation and on checking both upper extremities and lower extremities. Respiratory wise, he has regular, easy, and unlabored breathing. Within normal resonance and resonance sounds on percussion. Gastrointestinal, his abdomen are soft and not distended. No visible mass or any sign of previous surgery. No lesion or scars. Bowel sound noted on the four quadrants. No tenderness on palpation. He denies any tenderness on when assessing it. He's not guarding. His liver and spleen are within normal on palpation and also on percussion. His breasts are within limits on inspection and palpation. Nipples are within normal limits, symmetrical, and no discharge. Get genitourinary within normal limits. He don't have any changes. Musculoskeletal, moves all extremities. He has normal gait and coordination. He is independent on ambulation, and he walks normally. He don't have any difficulty moving around. Neurological, he's alert oriented times 4, no loss of consciousness. Psychiatric, he has appropriate affect and mood. He don't have any suicidal ideation. So for the plan, I would order for complete blood count and CEMP. That will help to know the baseline for his lab test. Especially, this is his annual exam. For medication, he is not taking any prescribed medication. I will just give education about reading the direction if ever he will be taking some over-the-counter medication. Non-pharmacological recommendations are exercise, sleep and rest, balanced diet. I would educate her that exercise is useful in helping not to have a disturbed sleep. And then sleep and rest, this disruption of sleep can have different effects in metabolism. Balanced diet will also help in having a positive impact in digestion. Patient education about testicular examination, diagnostic imaging plays a pivotal role in initial diagnosis and staging of testicular cancer, as well in assessment of treatment response and follow-up surveillance. Patient education also about eating heart healthy diet. And so with my interaction with the patient, he is compliant with the discussion that I had with him. So I recommend to see him as needed, and also recommend to do monthly testicular examination, to do cancer screening as prescribed by the doctor, and make sure that he's eating meals, healthy meals, and exercise. So thank you for listening, and if you have any question about my assessment, you are free to reach out to me. And for now, I am going to go ahead and document this if you're okay with that. So yeah, have a good day. Thank you. Bye bye.